Dr. Victor R. Potenciano, well, was the first man I met when I was born. He had lived for only 59 years, but those were very, very important years to me. He was a very ideal father, okay, a very loving husband, and a true family man. He treated us and his patients alike. He was very warm, he was very courteous, he had excellent bedside manners as a physician, which I think really made a lot of patients love him so dearly. I remember Dad inviting top caliber physicians, mostly those who graduated also from the College of Medicine of the University of the Philippines. When that idea came about, he already had decided to put up the hospital behind Potenciano Polyclinic.
Polymedic started with a series of meetings in the place where eventually it was established in order to prepare for the establishment of the hospital.
He was they would call him a medical officer, and that was the reason why he had to establish two clinics, one near the U.S. Embassy, and later on, he decided to purchase a piece of land here in EDSA. Well, it wasn't EDSA yet. It was, they call it Highway 54. He selected a very prominent architect to design the structure, and that was architect Cancela. Well, Dad also selected a very notable contractor, the person of engineer Eduardo Santiago. Okay, once upon a time, Polymedic General Hospital was the only landmark here in Highway 54 because it was like 10 stories.
He was a very gentle individual, very knowledgeable, and one good trait he had, he treated his patients, both rich and poor, the same.
Among the challenges were it had at one point to be mortgaged. It took time for the hospital to earn the income needed to pay off the mortgage.
Like any new institution, financial was one of the biggest problem. And slowly we were able to overcome the financial difficulties.
To me, the most significant and very challenging aspect in the history of VRPMC was the COVID-19 pandemic. And you can imagine the impact of this. The census was low, finances were very, very low. But paradoxically, because of the pandemic, there were a lot of COVID-19 patients that were brought in. This brought about the financial aspect that sustained the needs of the hospital at the time. But in the meantime, we made sure that the hospital personnel and all the doctors were vaccinated against the COVID-19.
We were forced to limit our admissions due to staff shortages because of illnesses, resignations, and exposures to COVID-19. So we had to act quickly and to look at our safety measures. We had to contend with rising costs and shortage of supplies. We had to work on infrastructure changes, as well as ramp up new services and diagnostic tests to meet the requirements of the pandemic.
Well, with COVID-19, we were really forced to keep and rise up to the unprecedented challenges and threats. It was nothing like we imagined we would actually go through. But it was also a time when VRP really rose as a family. No? So with so many uncertainties and risks, I saw each member rise up and step up. We've come out to be a bigger and better VRP.
During the past 2 years, we have set up really quite good and state-of-the-art facilities.
We will offer and fulfill the needs of our patients, as we have done so for years, today and in the coming years.
VRP was the first ISO certified hospital back in 2001. So it's been 22 years that we've maintained this certification.
Yes, we're proud of the fact that we were one of those instrumental in getting the hospital the first ISO certified.
This was really the DNA of the VRP Medical Center, which ensured our quality service to patients and even the general public, and which enabled us to survive through good and critical times.
I would like to give our patients here in VRP the best in cardiovascular diagnosis and treatment. Also, we just opened up our kidney transplant group. Then one of our innovative clinics here are that of, firstly, our Life Balance and Plasticity Center. Mental health is one of the important problem that crop up during the pandemic. We have also our wellness clinic.
Gradually now we're already, recovering and resuming our plans that were put on hold because of the pandemic. Soon, maybe we will be revisiting our plans for the medical tower, the 18-story medical tower.
Okay, there is a saying that charity begins at home, but it should not end there. The services of VRP Medical Center doesn't end here. So we made sure that we reached out to the marginalized sector of the local government, and we had this OPD Damayan, And of course, we still offer the same services. The Damayan clinic is now at the basement of this hospital, and there are days assigned to each department, and each department would go there and give the services to the patients.
It took a neonatologist, Dr. Puraflor Isleta, to start the breastfeeding initiatives at VRP Medical Center way before the DOH and the WHO required us to be mother-baby friendly.
Well, VRP Medical Center has always taken pride in its mother-baby services and programs. So in 2012, we applied with DOH to be a mother-baby friendly hospital.
Since its certification in 2014, we were able to maintain the program through the years, and we were able to supplement the facilities such as lactation center, the women's health center, the EINC unit, as well as special care unit, and the pediatrics development center. We have been able to host the 2 congresses on breastfeeding. In fact, one of it was the first Asia-Pacific Breastfeeding Congress.
Dr. Victor R. Potenciano is really a pillar, in medicine.
What Dr. Potenciano will think about all these changes happening now, I think he will be very, very happy, and he would tell us, good job.
If VRP were alive today and still with us, his message will be service to the people and to follow our vision.
I can see that what he would say is that nothing is more rewarding than seeing patients walk out of the hospital in good
he would have been proud of the achievements of the hospital. I'm sure he would be smiling and saying, "Well done."
I think Lolo Titong would be beaming with pride and happiness to see that, the family has pursued his dream and to see how much VRP has grown from his humble beginnings in polyclinic.
I can picture him smiling down at us, saying to us, "Good job."
50th year, I think, is just the start of the renaissance of VRP.
As we turn 50, we only hope to get bigger and better. We will continue to work towards fulfilling our commitment to providing a safe space for our patients, provide efficient and innovative programs, and continue also to provide a nurturing and compassionate environment for our patients, the Alagang VRP way.
Alagang VRP, that was our rallying call. We were known as the hospital that cares.
VRP does not only offer those advanced technologies that will more or less assure recovery from the disease, but it has something that is beyond treatment, and that is what we call the Alagang VRP, a compassionate, family-centered, God-centered treatment wherein our doctors look at our patients as part of family.
VRP Medical Center, we are proud of you. I'm sure that Dr. Potenciano would be proud of you. Continue your good work and take care of more patients.
VRP will live long and continue to prosper into the next decades. This is because of the people who made up VRP as it is today, and because of the patients who believe in VRP. For that, deep in my heart, I congratulate VRP and the people who made it. It is no simple achievement to last for 50 years and still going strong up to the present.
Well, I know Dad pulled his life savings to build this hospital and took on a loan from GSIS when they decided to start with the construction of the hospital. But despite securing the funds, a national crisis occurred. This was actually a big burden to the corporation. My dad was not known for, the properties he owned or his father owned. He was known for a hospital he built. We wanted to continue his legacy. I think that was the best decision that we